Welcome to The Explainer. Today, we're breaking down a common but often misunderstood condition called adenomyosis. It affects a lot of people, but getting clear answers can be tough, so we're going to clear things up.
So, here's how we're going to tackle this. First, we'll talk about the symptoms, what it actually feels like. Then, we'll get into what adenomyosis really is. We'll also clear up how it's different from fibroid tumors, which is a common mix-up. After that, we'll walk through the typical treatment path. And stick around, because we'll end on a really promising non-surgical option.
All right, let's just dive right in. We're going to start with the two big symptoms that usually have people searching for answers in the first place.
So, does this question hit home for you? If you're nodding along thinking, yep, that's me, then you might be dealing with something like adenomyosis, or maybe even fibroid tumors. These two things, really heavy periods and a lot of pelvic pain, are the absolute classic signs.
Okay, so what in the world is adenomyosis? Let's get right into the specifics of what's actually going on inside the body.
So, at its most basic level, adenomyosis is when a specific part of the uterus, called the junctional zone, gets thicker than it should be. Now, this zone sits right underneath the uterine lining, the part that's called the endometrium.
And the diagnosis gets really specific. Doctors are actually looking for a measurement. If that junctional zone gets thicker than 12 millimeters, well, that's the technical cutoff. That's when it's considered adenomyosis.
So the big question is, why does it get thicker? Well, it happens because the cells that are supposed to stay in the uterine lining, that endometrium, they start to basically dive deeper into the muscle of the uterus, which is called the myometrium. And the more those cells push their way in, the thicker that junctional zone gets.
All right, this next part is super important because it's where a lot of confusion comes from. Let's talk about how adenomyosis is different from uterine fibroids, especially since the symptoms can feel so similar.
This chart lays it out perfectly. Look, both of them can cause heavy bleeding and pelvic pain. That's a given. But here's the key difference, generally speaking. With adenomyosis, the pain is usually the biggest, most significant complaint. But with fibroid tumors, it's often the heavy bleeding that's the main problem.
Now that we've got a better handle on what this is, what can you do about it? Well, the treatment options are usually laid out like steps on a ladder. You start at the bottom and work your way up. So that first step on the ladder is usually something like an anti-inflammatory medication, like ibuprofen, just to manage the pain. If that's not cutting it, the next step up is often a hormonal IUD. And if that still doesn't provide relief, the final traditional step is a hysterectomy. That's the only surgical way to completely get rid of it.
But wait, why is surgery so different for these two conditions? I mean, why jump to a hysterectomy? Well, unlike a fibroid, which is like a distinct little ball that a surgeon can just go in and remove, adenomyosis is, well, it's diffuse. It's spread out within the muscle with no clear edges. So you can't just go in and cut it out. And that's what makes hysterectomy the only surgical solution.
But let's be real. A hysterectomy is a major surgery. And for a lot of women, it's just not the path they want to take. So let's look at another really important option that's become available.
And that brings us to this. This right here points to a huge development in treatment, a way to handle both adenomyosis and fibroids without major surgery. It's called uterine artery embolization, or just UAE for short. It's a non-surgical procedure, and here's the interesting part. It's the exact same technique that's used for fibroids. You might have heard of that as uterine fibroid embolization, or UFE. So UAE and UFE, basically the same procedure, just used for two different but related conditions. And what's amazing about this procedure is how incredibly versatile it is. It works if you just have adenomyosis. It works if you just have fibroids. And, really importantly, since it's pretty common for women to have both conditions at the very same time, it can treat both of them all in one go. So, after all of this, what's the right path for you? Well, the most powerful thing is just knowing that you have options. It's not just one road. Knowing everything that's on the table, from medication to surgery to really effective non-surgical procedures like UAE, that's the first step. It lets you have a real, informed conversation with your doctor to figure out the absolute best answer for your health.